We're talking about the fact that, 50% of people with high blood pressure are not appropriately treated and don't have it under control. Over 90% of people with heart failure are not appropriately treated and don't have it under control. The system's not working. And we're talking about 50% of doctors who are burnt out and demoralized. People are calling it moral injury. I mean, that's what the literature is calling it. So it's not working for providers, the people in the system, and it's clearly not working for the American public who the system should be serving. And so could we keep on going and doing the same things and saying, let's just do it harder and faster and do it bigger? No, I don't think so. I think that's foolishness. We really need to reorient.
Hey, Uncommon Leaders, welcome back. This is the Uncommon Leader Podcast, and I'm your host, John Gallagher. Dr. Zeev Neuwirth, welcome to the Uncommon Leader Podcast. It is so great to reconnect with you and have you on the show. How are you doing today?
John, doing great. I love seeing you, and I'm so excited to be speaking with you.
Yeah, it's going to be a great conversation, and I want to jump right in. I know we're going to get a chance to talk about your new book, Beyond the Walls, Megatrends, Movements, and Market Disruptors Transforming American Healthcare. But before that, I'm treating you like the same I treat every other first-time guest and ask you a question I ask him is to tell me a story from your childhood that still kind of impacts who you are as a leader or person today.
So when I was growing up, my dad is an immigrant to the United States and very proud American. And he's an engineer, a mechanical and electrical engineer, grew up pretty modest means, and but became a professional and did some amazing work in his career. One thing about my dad is, which was just all the time, everywhere, was that my dad would talk to everyone, and it didn't matter where we were. If we were in the gas station, he would talk to the gas attendant. If we were at a restaurant, he would talk to the waiter or waitress, or even, the bus boys or, anyone. And what was really remarkable to me was he treated anyone with such respect and such decency and such dignity. And he used to, when we got a little older and we were teenagers, and, he would say to me, Zev, I talk to, 3-star generals, and I talk to CEOs, and I present in front of these groups as he was doing his work in engineering and design and then sales of his products. He said, they're just the same as anyone else. People, put on their pants the same way. They struggle the same way. And so, I believe every human being deserves and needs that sense of dignity. And what I loved about what he did too was, my dad loves to talk. And that is, as you'll get to see, and your listeners will get to see, that is one of the attributes I did get from him. You already know that about me, John, but
yes, I do.
But he also listened, and he was a really good listener. And again, every gas station, it was actually, I have to tell you, it got to be a bit much, because we would stop at a gas station and there he was talking to the gas attendant, and he could talk with that person for like 20, 30 minutes. And we're like, hey, Dad, we got to get going, and same thing at the restaurant, same thing on the streets. And he just really, I think, saw the best in people and brought out the best in people and was curious about people. And again, it's that respect and dignity, which I think has guided me throughout my entire career. And actually is one of the reasons why I've taken the course I have in healthcare, because I did not see that same sentiment and same approach in healthcare delivery.
Zev, I love that. And yes, I do know you well enough to know that you like to talk. I also know that those positive attributes that you really talked about, the respect and dignity, are something that drew me to you when I first met you years ago. So I appreciate you sharing that story, and I'm sure that's the way you've continued, even though we haven't been working together for a few years. So let's jump into what we really came here to talk about, though, and that was your new book that's just come out. It's #1 in healthcare delivery on Amazon right now in terms of new releases, and #1 in hospital administration for new releases right now already. And as we record this episode and as I release it, it'll be the day that your book is officially released. So I know that's an exciting time. But tell the listeners of the podcast, why did you write this book and why now?
Yeah. this was going back a few years, probably about 7, 8, 9 years ago. I've been in healthcare, as you know, for decades, and as a practicing primary care physician, and then a physician manager, and then a physician executive, doing process improvement and quality improvement and care redesign and human-centered design, and then population health and operations. And so I've been in the belly of the beast for well over 30 years. And about 9 years ago, I just had sort of a series of things happen where I just realized that what we were doing was not going to get us where we needed to go. We've been doing, and I've been part of this, movement after movement, bright, shiny object, science, technology, this, that, the other thing, thinking operations management, thinking that was going to get us out of the dilemma we're in. And all of a sudden, I just had this realization that it wasn't, and that we needed to start doing something really different and in different ways and thinking differently. And so, and this because I'd done this even back when we were working together, I started to call up people around the country and around the world who were really reframing healthcare, who were taking a completely different orientation to the problem. They were, in some sense, going beyond the walls, right? Literally, conceptually, systemically, operationally. And so I started to interview them, and I did this for myself, and I would record these interviews, and then I would study the transcripts of those. And then I began to see a pattern, and I wrote about that pattern in my first book, Reframing Healthcare. And I've continued to literally do that now, obviously with a podcast, but I've recorded and interviewed hundreds and hundreds of these beyond the wall leaders. And, the approach is something which the scientists call positive deviance. So this is when there are things out there that are working, and instead of trying to focus on the problem with the same sort of tools that you've been using, why don't you go out and see people who are actually solving the problem with different ways of thinking and different ways of doing it? And that's essentially what I've done. And in terms of the why and why now, I think the facts are pretty straightforward. The healthcare system is completely broken. It is not working. And we're not talking about, yes, there's 30 million people that are not insured in America, but there's 100 million people with severe medical debt. 100 million, over 40% of Americans are carrying medical debt, which is destroying their lives. And I would say that the vast majority, over 80%, struggle with medical care. In fact, there was a recent report I saw that said in the last year, it was a national poll. In the last year, 50% of Americans who were surveyed said that they either deferred, delayed, avoided medication or medical care because they couldn't afford it. 50%. So we're talking about a system that is unaffordable and unattainable for the majority of Americans, and it's getting worse. And, we could talk about the inequities and disparities in care, where literally people across the country are living shorter lives than people in third world countries. We're talking about maternal fetal mortality rate, which is the same as it was in the Civil War era for Black women and Black children. On and on and on. We're talking about the fact that, 50% of people with high blood pressure are not appropriately treated and don't have it under control. Over 90% of people with heart failure are not appropriately treated and don't have it under control. The system's not working. And we're talking about 50% of doctors who are burnt out and demoralized. People are calling it moral injury. I mean, that's what the literature is calling it. So it's not working for providers, the people in the system, and it's clearly not working for the American public who the system should be serving. And so could we keep on going and doing the same things and saying, let's just do it harder and faster and do it bigger? No, I don't think so. I think that's foolishness. We really need to reorient. And so the time is now. The time is, every expert I've talked to has said the same thing. Every single one, without exception. The system is not working and it's unsustainable. It's off the tracks and we're heading for something catastrophic. And, and so it's imperative. It's an existential issue, which again, so many of the experts I talk to talk about that. It's a moral obligation for leaders. And so in the book, I don't talk about problems. I don't talk about, the past. What I'm talking about is dozens and dozens of courageous, bold, innovative leaders that are taking a completely different approach, bringing new ideas that are actually working. Why don't we actually study them and look at what they're doing, invest in that, and scale them? And that's the approach I've taken, which I think is incredibly inspiring, incredibly hopeful, incredibly practical. And by the way, CMMI does the same exact thing. They use a positive deviance approach. So the federal government is trying to take that. And so does the VA system, which is probably the test kitchen for innovation in American healthcare.
Zeev, thank you. Thank you so much for sharing that. And I would say that is a fairly monumental reason for action. But what I love about what you said at the very end, you said there is hope. And there are leaders who are doing something about it. It feels like David versus Goliath at times in terms of the size of the problem, but there are leaders who are doing it. Inside of your book, you're portraying leaders who have those approaches. Is there any one story of a leader that really sticks out to you that you wrote about that you're proud of?
Wow. The great thing, John, is that, as you point out, and there are dozens, if not hundreds, that I wish I could share with you. And again, in the book Beyond the Walls, I share these hopeful, inspiring, informing, and real leaders who are doing real things now. So it's not hypothetical, it's not academic, it's not research. This is really happening in the open market. And some of them, just to be very clear, some of this is happening within traditional healthcare, hospital systems, provider groups. As I mentioned, the VA is just on fire. They're doing amazing work there. But so it's not just the entrepreneurs who, again, I take my hat off to the entrepreneurs who've gone beyond the walls, but it's really people who are, outside of the walls and behind the walls, these beyond the wall thinkers and leaders that are working together. And again, that's why it's so hopeful. And I will say this, I talk to a lot of my contemporaries, and John, you probably know this as well. A lot of people are jaded. They've been in the business for 20, 30 years, and even the younger folks, and they're burnt out, they're jaded, they're demoralized. I tell you, John, you and I've worked, a long time ago together. I have never, ever in my entire career been more inspired, more hopeful, because I have been making it my business to listen to these beyond the wall leaders. And all we have to do is really create that. And it's a movement. It really is and should be a movement, which is what I'm excited about. A story. There's so many. Look, there were a couple of researchers and who came out of the VA, and I have to take my hat off to them, because I began my career in the VA system, many years ago. And they were noticing when they were teaching doctors, and they noticed that their students, their residents, were coming back and sort of telling them, okay, listen, this is a patient, 55-year-old with these sort of medical problems, and here's the solution, I think. And they would go back and then talk to the patient, and they started to hear something which had no language, had no ideation. There was nothing to even call it back then. But it was like when they started to actually hear the patient's lives, they realized that the context of the patient's lives would not allow for that strictly clinical medical approach to work. It just wouldn't have worked. The patient's lives, whether it was the resources they did or didn't have, it wasn't going to work. And so they didn't have a name for this. And so they started to literally study this problem. And they recorded literally over the past 20 years, over 6,000 doctor-patient visits. And they not only recorded them and videotaped them, they actually coded them in a radically new way. And what they discovered and coined was something called contextual care. And they said, you know what? There are a few factors that we keep on seeing. They actually have 12 factors. So it's not 100, 12 factors. They call them these contextual errors or these contextual barriers. And if you identify them in the conversation with people, with patients, you can actually identify them, you can actually explore them, and you actually have solution sets for each of them. And so over the past 2 decades, they have studied this. They have published repeatedly in bona fide medical journals. They've written books about it. And now they're taking these contextual barriers and they've embedded it in a state-of-the-art AI-enabled care management system with protocols. So the machinery is actually picking up these contextual factors as the care managers and clinicians are talking to the patients and their families through natural language processing and other ways. They're picking up these contextual factors. They're triggering the team to notice them. They're actually helping the team explore them. And there's actually embedded solution sets to actually help the care management teams and clinicians deal with these contextual factors. And they're beginning to show outcomes in terms of now with they've demonstrated outcomes before, but now they're showing it embedded in automation, state-of-the-art automation and technology. And they're showing reduced hospitalizations, reduced readmissions, reduced cost of care, improved outcomes of care. It is such a brilliant story. I spent a whole chapter in my book talking about this story because it is so powerful. And again, these entrepreneurs came out of the VA system. They came out of the belly of the beast, which again, I find so inspiring. And again, for me, John, I don't like the blame game. We are in the healthcare system. I see, in fact, people using military words and warring and blaming and pointing fingers. Let's not do that. People who are outside the walls and inside the walls, we've got together. And this is one of the best stories I've seen in terms of, really humanizing healthcare using state-of-the-art technology.
Zev, love that. Utilizing technology along with the leadership qualities that go along with that. I can't wait to read some of these stories. I know they're going to be really cool. And when I get the copy in my hands, I want to ask you, you mentioned some of the leaders that you come across in terms of what's happening in industry. They're burnout. You use the term jaded, demoralized as well. The stories and the leaders who are carrying those things forward. As leaders listening to this podcast, what are the qualities that you see in those leaders that allow them to, in essence, overcome the challenge that is healthcare, that they're actually able to transform healthcare? What are their qualities?
Yeah, that's a really great question. And I'm going to be totally honest with you. I think what attracted me I'm going to be honest with you and throughout, completely transparent rather, because I've been honest, but I don't know that I have a great answer yet to your question, but I will tell you this, that, I've been interviewing these courageous, bold leaders for now close to a decade. And, it's the things they're doing. And again, so many stories come to mind. I literally could spend the next few days with you, just one story after another, just amazingly positive, things that are happening in healthcare here and across the globe. But what excited me about these interviews and what's really inspired me and kept me going is that these folks were not only reorienting and reframing healthcare delivery, they were reorienting and reframing themselves. It was a level of integrity, which I have to tell you, I admire from a distance, because I'm not sure that I actually have attained that level of integrity and leadership yet. But they weren't staying the same. They actually had to transform themselves in order to transform what they were doing. And no one ever taught me that. I've never seen that in any leadership book or text. And it wasn't the typical, here's what a leader does, and here are the skills, and here are the talents, and here, it was really just a openness and a courage and an integrity to say, I've got to change. Concrete example of that, Sean Duffy in Harvard Medical School, in Harvard Business School. I write about him and so many others like him. There he is on Longwood Avenue in Boston, premier medical school, premier business school. He's getting a dual degree. And he sees that people are coming into the Longwood area, to the hospitals every single day, into clinics every single day. And he says, you know what, with the technology we have, and this was back in 2008 or 9, so this is not like, today or yesterday, this was over a dozen years ago. He says, we have the technology now. This is wrong. We need to bring healthcare to people using the technology. And so what does he do? And again, talk about integrity, talk about conviction, talk about commitment. He leaves Harvard Business School and he leaves Harvard Medical School, and he goes and he studies digital technology. He literally takes a year or two to go study that, to work in a company. So he trains himself. And then he goes and he works at IDEO to learn how to do design and product development. And who does that? Who has that level of conviction and commitment? It's like, I believe healthcare should be this way. I'm actually going to change my life and change myself in order to make myself a better leader for what I believe we need. And he goes and he does that. And then he creates Omada, a company, one of the most brilliant, trailblazing digital health companies. And again, I could tell you story after story after story of leaders, Chris Chen from Chen Med, a cardiologist, Harvard trained, Cornell trained, cardiologist, brilliant, could have done anything, could have made any amount of money he wanted to, completely left that to do primary care, to serve the frail, poor, elderly people in a radically new way, using Medicare Advantage payment, completely transform primary care. Again, who does that? Who does that? Beyond the wall leaders.
There you go. Amen, brother. So transparency it was. You just talked yourself into those qualities, right? Courage, integrity, commitment, conviction. Those are huge, okay? But what I hear in terms of reframing self is humility as well, though.
Mm.
That I don't know it all, and that I've
Yes.
got to transform myself to be able to transform this process and understand it. So, your previous book, Reframing Healthcare, absolutely have to reframe yourself and who you are as a leader. So thank you for sharing that. Thank you for sharing, frankly, the passion in which you shared it, right? You've got to have conviction. You've got to have some level of thick skin to try and fight the system that is healthcare delivery today and all the things that keep it from going forward. I hear that passion, and I know you wrote this book and you want the people that read this book. So oftentimes, like you see, we're not doing video, but you see the books on the back of my shelf.
Mm-hmm.
People read the book, they'll put it up on the shelf.
Mm-hmm.
But the 1-year test is when they look at that book and they say, I remember a story from that book. This is how it made me feel. This is what it made me think. And this is what it made me do. This book right here, I can put it in one sentence. What do you want the readers of this book to feel? What do you want them to think? What do you want them to do after they've read this book, Zeev?
Well, first, I wrote the book for lots of folks, but specifically for leaders. And I've talked to some colleagues who are not sure leadership is ready for this book. I actually disagree. I think leadership is ready. I've seen it. It is a catalyst for leaders. I think people, if you read it, I can't imagine you won't be inspired. I can't imagine you won't be informed. I can't imagine, quite honestly, that you won't walk away with at least 1 or 2 or 3 ideas that you yourself can implement today where you are. And that's what I want people to do. Is I clearly the inspiration is going to be there. I've already had feedback. I handed the book out to about 120 people, and I've gotten tremendous feedback. People are so inspired, but I think they'll also be informed and real life examples. And so I wrote those real life examples in there. These are the exemplars. This is, again, the positive deviance. We could pick up, whether it doesn't matter, what your situation is, what your profession, there is something you can pick up from the book that you could literally start to do the next day or start to implement. I mean, I think even just sending the message out there, even, getting the book, you, John, even before we got on, you said, I'm going to take this book and hand it out to, 2 or 3 friends immediately. Even that is an action, right? Creating spreading the narrative, spreading the inspiration, spreading the information. That is a positive step, because if we don't do that, then it just disappears into ether. This has got to be that, in the epilogue to the book, I actually do have a call to action, and I share a couple of stories, which I think are important. First of all, I just addressed the issue. What can I do? You can do a lot. I mean, people say to me, I even ask myself, like, is what I'm doing worth anything? Like, what am I doing? Right. Well, I mean, I'm at, I have this podcast like you, and I'm getting out the message out to thousands and thousands of people. And, even if I reach one person who can change something, oh my God. I was at a conference in Boston about a month or so ago, and some guy ran up to me and he said, oh my God, are you Zeev Neuwirth? I was like, yeah. He goes, I read your book, Reframing Healthcare, completely changed my thinking, completely changed my career, completely changed everything for me. And he was so excited. He ran home, got the book, brought it back to the conference, asked me to sign it. And I was, so, it was wonderful. But then I found out who he was and what he did. This guy is like the chief medical officer for Medicaid for the entire state of Massachusetts. And I asked people about him. He's amazing. I mean, people love him. They just, and look at that. And here's something I wrote, which affected someone. We don't know when you hand the book. I mean, if you work in a healthcare organization, get this book to your C-suite, get this book to your board members, because the board members have to read this book. They have to understand the 3 domains I'm talking about. If we don't do these 3 domains, we will not get out of the dilemma. It is a comprehensive approach that I outline with real life examples. And so, what can I do? If you don't know, call me up or email me after you read the book, and I'll be happy to talk to you about what you can do. The issue also is this, and I talk about this in the epilogue. John, you know this. I've been talking about this for quite some time. When things in healthcare were amazing and people were making crazy money and revenue, just coming in, and I would talk to groups and they would say to me, Zeev, listen, we can't change now. And I would say, why? and they would say things are too good to change. Why would we change anything? Why would we do something new? Why would we go beyond the walls? Why would we reframe now? We're making so much money. Okay, that's great. And then now when things aren't as great and the revenue isn't as forthcoming, and hospital systems and other healthcare systems are kind of in a quasi survival mode, and money is tight. And so now I hear, well, Zeev, you can't expect us to reframe. You can't expect us to go beyond the walls. You can't expect us to humanize healthcare. And so, the problem is this: it's never the right time. It's never the good time to change. And John, you taught me this years ago. Leaders don't, their conviction, their commitment is not dependent on the current moment. You can't let it be. It cannot deter you. True leaders understand that. They have to transcend the current moment. They have to say, this is what we have to do. This is the hill we have to take. This is what we have to accomplish, not tomorrow or the day after that, but literally now. And with whatever means we have, we will do it, because something, it's never the perfect time to change. And so that's what I would say to folks is the time is now. The time is past now, quite honestly. I shared with you the information, the data. It's pretty evident the reason why. And what can you do? There's 1,000 things you could do. The first one is read the book.
Zeev, you told me you were fired up when we got on this call. You have been, man. This is great. I love it. Absolutely. Just a little bit of a turn here as we get up in our time, and I want to respect your time. And I so appreciate what you already have invested with the listeners of the Uncommon Leader podcast. The proceeds from your book you're donating to Feeding America. Tell me about that. How did you decide to do that as well? I didn't really tell you I was going to ask you that, but I saw that. I read about it. What's there for you?
I wanted to donate the proceeds from the first book to a nonprofit, and so when the second book, was when I saw that it was going to happen, I thought about this long and hard, and I just, a bunch of reasons. One is, first of all, Feeding America. It's heartbreaking to think that so many people in our country, and it's not a small number, don't have enough food, and especially for me, it's the children. Just it breaks my heart, and so it's a good cause, right? And so, and there are lots of other organizations I could have contributed to in the same area of Feeding America, but I chose this one. And the other issue is this for me. I don't practice clinical medicine anymore. And I see friends and family members who are clinicians and physicians, and they do these mission trips. And I guess I could go as and sort of help and do non-clinical stuff. But for me, I thought to myself, wow, this is my mission trip. I'm going to take my proceeds, and this is going to be my mission, is to, as I go out and I do talks, and I hopefully the book will be read and sold. And again, I really believe, John, this book needs to be in the hands, the hearts, and the heads of every single leader in American healthcare, in every domain, whether you're in a hospital system, a provider group, pharmaceutical industry, medical device industry, insurance industry, PBMs, the federal government, state governments. This book needs to be in their hands. They have to understand what it is we need to do, what is working, what we need to really resource and change policy and healthcare around. That's my mission. And I'm not talking about a few thousand. I'm talking about hundreds of thousands of people who need to read this book. And part of the reason that I donated it is because I feel so good about saying that and telling people that's my mission. And I want them to make it their mission, and to know that I'm not going to make 1 cent off of that. This is about my mission, and I want others to make it their mission.
Thank you very much, Zeev. Appreciate that. Folks know where they can get the book: Amazon, Barnes & Noble, all those different outlets that sell books. You can go anywhere to find it. But how can they find you, Zeev? Where should folks stay in touch with you and learn more about you?
Well, the podcast is one. There is a website now, which I'm probably going to change, but it's www.reframinghealthcare.org, is it, or com? Sorry, I should know that, right? And
I'll put a link in. So
could you really? Yeah, you can see how great a marketer I am of myself. I don't even know the name of my own website, but yeah, no, I think and truth be told, I'm on LinkedIn. Actually, that's probably the fastest way. If you just go to LinkedIn and you message me, I promise you, if I'm on, which I am pretty much every day, I will get back to you. I promise you that. So LinkedIn is probably the easiest way to find me.
Very cool. Thank you, Zeev. I'll put that link in there as well for LinkedIn. Okay, I'm finishing up. I only have one more question for you, Zeev. Again, I appreciate you investing the time with us. It's the same question I always ask the first time guests on the podcast as well. And I think you're going to have something passionate to tell me again. Let's bring it. But I'm going to give you a billboard. You can put anything on it that you want to. Okay, you can tell everybody the message you're trying to get out there. What do you put on that billboard and why?
Listen. One word, listen. You were asking me, John, before about leadership. And I think the most powerful leaders, bar none, not just in healthcare, but across the board, this is what I've witnessed, is just our incredible listeners. And they hear not just the story, but the story behind the story. And they hear the soul behind the story behind the story. And they hear the spirit of it. And I think listening is the thing we need to do. In fact, in that story I was telling you about contextual care, there was a great quote, which I'm going to really mess up now, but to really help someone, ask a question, right? To really help someone, just ask a question. It's such a profound, it was taught by one clinician to another clinician. I think actually it's more like, to really show you care about someone, ask them a question. And, not a biased question, not a predetermined question, but a real question. And I heard something else even this week. I was talking to another phenomenal Beyond the Walls leader, and he quoted something around, instead of being experts with answers, and this goes to your leadership question, instead of being experts with answers, why don't we become catalysts with questions? Don't you love that?
I do
Instead
love
of being,
that.
I know, right? Instead of being experts with answers, let's become catalysts with questions. And so you do that, you show people you care for them by asking open questions and real questions to inquire and learn and appreciate about them. I tell you, if we did that, it changed the world.
Well, I think this book has a chance to get us started on that journey, Zeev. I'm looking forward to reading it myself. I do. Once again, thank you for investing the time with the Uncommon Leader podcast, and I wish you the best. Let's stay in touch.
Oh my God. Thank you so much, John. Such a pleasure.